right? 东石针灸. Um, as we know, the legacy of Master Dong is quite complex, actually, because when we think of Master Tung Acupuncture, first of all, we have to take away this idea that Master Tung Acupuncture has no basis in Chinese medicine, right? It's almost like people believe that, well, some people believe Master Dong, for example, he was taught by immortals, you know? Well, I don't, well, that, I don't want to say that is implausible. It's more likely that there was a refinement. And we have to understand that throughout Chinese culture, it is always said that, you know, whenever somebody tries to pass that knowledge, that immortals come and teach you, right? Because that's basically the attunement from heaven. That how can you question the immortals? This is the knowledge from the highest, right? And I think it's the same thing happening. And secondarily, we have to keep in mind that throughout all of history in China, no lineage, no specific tradition tries to divorce themselves from the classics, from the source. This is a historical, not opinion, this is a historical fact. While people try to maybe shift the traditions, right? They never try to say, I myself invented this 100%. Why? Because what happens when you do that, you basically divorce yourself and people begin to look at you as kind of crazy to some degree. That's why people always try to say, no, this comes from Zhang Zhongjing. This comes from Huatou. This comes from Bianque. This comes from an immortal that visited me from my dreams. And they passed on the knowledge to me. Even if that's not necessarily true, there's always this connection to some kind of old antique figure or books. And I want to try to showcase to you, Dongshi Zhenjiu is not separate from Chinese medicine, but it is distinct. Okay, I am not saying it is not a distinct tradition. It is quite different. I guess. So of course we all know the master, right? Dong Jing Chang, right? So he lived from 1916 to 1975, right? And of course, what's, you know, I'm not necessarily a historian of the master, right? But I will say that unfortunately, he sort of died in not the most ideal way. And that is because, remember, he came from China, and I'm going to showcase from what province and everything. But when he came to China, from China, when he fled, you know, because of the nationalist and communist kind of clash, of course, he was a nationalist. So obviously the nationalists lost. So they fled to Taiwan, as we know. And yes, he practiced there, but eventually we have to understand Taiwanese healthcare to really understand Master Dong's placement in the Taiwanese healthcare system. Let's just say that eventually, at the beginning, when people started just fleeing to Taiwan, there was really no standardization of medical system, especially Chinese medicine. It's like, you want to do medicine, just hang on a shingle, and you could start just stabbing people, right? As long as you have some sort of advertisement, some sort of reputation. But eventually there was now the beginning of licensing exams. And unfortunately for Master Dong, he did not have any formal education, right? His education was passed on by his father and maybe his grandfather, right? And so with that being said, they denied him a licensure. And when that happens, well, imagine somebody has dedicated their whole life to cultivating a jewel. And when they cultivate this jewel, right, of medical knowledge and expertise, he is denied licensure. So of course, then he basically got I believe he got a cancer or some type of illness in his stomach, pancreas, I forget the type of specific disease he got. But obviously, from a Chinese medicine perspective, we know that illness often is results from some type of emotional heartbreak, some type of emotional chaos. And when you dedicate your life to something and you're denied something, that gives the opportunity for xie for evil qi, right, to come and take away your life, because it's taking away your mean, your purpose, your destiny, right. So that must be remembered. Same thing happened to a famous herbalist called Qin Bo Wei. Qin Bo Wei. And Qin Bo Wei also at one point was taking a license, and he died basically scrubbing toilets, And it's interesting because Qin Bo Wei at one point was treating like the highest Russian officials of HIV and stuff like that. So to go from there and then to go to scrubbing toilets, imagine what that does to your shen, right? And how that's going to impact your health. So the same thing happened, unfortunately, to the master, right? But fortunately, he's passed on his legacy, and unlike his predecessors, did not keep his knowledge to himself, right? He did not keep his knowledge to himself. He basically embraced a scholastic tradition, because we have to understand that in the sharing of Chinese art, of any Chinese art, there's kind of two ways to go about it. There's the scholastic tradition, and scholars, they share, right? I'm a scholar, so I share, right? But then there's other people who have refined the skill, and sometimes they're even better than scholars, okay? Maybe not in knowledge, but in skill, okay? But then there's scholars who have both. But these people who are this, what we call this gong, gong, gong means an artisan, a worker. And doctors were often classified since the Han Dynasty as a gong, right? And a gong means, again, an artisan. It's kind of like an artist, because doctors have hands-on skills. They're not scholars. And so if you have a hands-on skill, that's your labor, that's your craft. So it's something you protect, because you cannot just share it to others, because then others are going to do it, and then you have no livelihood. So we have to always keep in context that the tradition of knowledge that's passed on is tied into a certain kind of financial, trying to hold on to some type of financial status, right? So for those that are interested, where the lineage comes from, the lineage comes from Shandong province, right? Shandong province. Shandong is an eastern Chinese province on the Yellow Sea. It is also home to the ancient state of Qi, the last kingdom conquered by Qin Shi Huang. Qin Shi Huang. If you know, Qin Shi Huang is the one that basically united China, imperial China, after, right? His dynasty did not last for very long, although he is probably the most famous. He's the first person to establish the reign of a Di, right? Not a Wang, because a Wang means a king. China had a lot of kings, different provinces, but he's the first Di, like a Huang Di, right? And Di means an emperor, right? So and the ancient state of Qi, not to be confused with the Qi that we know as like the gas and vapor, but this Qi is an interesting state, because Qi has a lot of history to it. For example, when you had the warring state period in the Zhou dynasty, right? We're talking about 700 to warring state is around 400 AD, somewhere around there, right? I mean, BC, 400 BC, somewhere around there, where all the states were fighting in ancient China. And the state of Qi, that is where you had the Jixia Academy. And if you know the Jixia Academy, you should know that academy, because the state of Qi did not have the luxury of a lot of agriculture, but the state of Qi became famous through basically trade, merchandise, right? Merchants. And when they became famous like that and prosperous, the state of Qi, then they built this academy called the Jixia Academy. And the Jixia Academy is a very famous academy because it basically sponsored through all of what was China, ancient China. It brought all the Chinese philosophers into that academy to preach or to debate or talk about their philosophies, right? People like Zhuangzi, right? People like Kongzi, people like Mengzi, right? And a figure that you should probably know, Zouyan, Couyan. He's the one who basically systematized for us 5 phases and yin yang, right? 5 phases, because before Zouyan, you had a lot of, liver affects the skin, right? You had all this different categorization, but Zouyan systematized this for us. And so what I'm really mentioning that for us because Master Dong's, where he's from, he comes from a place that's very rich in philosophical and medical depth. Okay, so which I think is cool. But now we're going to try to talk about, right? I'm going to try to be direct with you, right? When we study Dong acupuncture, we have to basically see how Master Dong is transmitting to people his knowledge, right? Often how people teach Master Dong acupuncture, they do it without any context to how Master Dong passed on his knowledge. And so it doesn't make any sense to me how it's taught. We have to try to look at the textual tradition of Master Dong. And of course, we also have to look at how the disciples transmit the knowledge. I'm not a disciple, but I do look at the context of Master Dong acupuncture, and I've dissected some of their disciples, studies and teachings. But basically, Master Dong began by basically leaving this teaching manuscript, right? This teaching manuscript in 1968. That's how he first basically taught his students, right? It's called Zhengjing Qi Xue, right? It's basically the Zhengjing, the Orthodox Channels Extraordinary Point Study, right? So it's just basically a compilation that Master Dong did for his students. But it's the first thing that Master Dong has basically put into motion in writing to pass on his knowledge. And we see the lineage's unique set of points being categorized in a certain format, a format that follows how the Orthodox tradition often describes, but with nuanced distinctions. But by what I mean, the Orthodox tradition is Master Dong is not necessarily categorizing his teachings in a unique way. He's basically following the standard of how acupuncture manuals have passed on their knowledge since the time of Huang Fumi. So first, Master Dong categorizes the points through body regions, as we know, right? Which actually has basis. So he did not invent that. Okay, so some of you may, why, because, in normal acupuncture, we study first, the lung channel, right? Lung 1, lung 2, lung 3, lung 4, lung 5, right? And then we go to the circuitry of the 12 channels or 14 channels to include the Ren and Du. And you say, and then when you study Master Dong, you have this kind of like, wait, 11, 11, 22, 22.1. It doesn't make any sense in a certain way, but actually it does. What he's doing is categorizing points through body regions. And that body region categorization has basis in one of the first manuals of acupuncture called the Zhenjiu Jiayijing, the ABC compendium of acupuncture, something like that. by Huang Fumi, right? Huang Fumi is a famous, I mean, he's pretty much one of the most famous acupuncturists that's ever lived, um, because Huang Fumi basically categorized and canonicalized the acupuncture literature of his time. And because of Huang Fumi, it's because that's why we have point indications, right? For example, Huang Fumi basically categorized to us the Lingshu and the Suwen, and basically what we call also the Bright Hall Classic, what we call the Ming Tang Jing. So he categorized that in the Zhenjiu Jia Jing. And anybody who's a scholar, anybody who is interested in acupuncture, they say, well, you have to study the Zhenjiu Jia Jing, the Zhenjiu Jia Jing to understand acupuncture. And I would say that I believe Master Dong studied Zhenjiu Jia Jing because of how he's even categorizing and organizing his points. So basically, you know, in this Zhenjiu Jia Jing book, in scroll 3, right, Huang Fumi categorizes all points, right? Zhu beginning with the head, right? Particularly the points by the interior headline, right? And then he just starts describing points in different places, right? Whereas Master Dong, he does it a bit different, right? He categorizes points a bit differently. However, this categorization of points by body regions already, as I said, has a tradition to it, starting with Huang Fumi. But Master Dong doesn't begin in the head. Right? He doesn't begin in the head. He begins in the fingers, right? He begins in the fingers, what's known as Yi Yi Bu Wei, the 11:11 section. Then you have the RR, the 22 section, which are the hands, the forearm, 33 section, the upper arm, the 44 section, the base of the foot, that's the 55 section. The top of the foot is the 66 section. The lower leg, you know, that's the 77 section. The upper leg will be the 88 section. The ear will be 99 section. The face and head will be the 1010 section. Then he puts the Hobei, the back section, what is translated as the dorsal torso, and then the front and chest, right? Which is also translated as the ventral torso. But what we want to pay attention, though, is the order in which he's categorizing the points first. So in other words, there's a meaning why he's putting the fingers first. There's a meaning why he's putting the hands first. And why do you think that is first? Well, first of all, think about it. If you put the fingers first, what are you actually saying? You are saying, well, my tradition is a tradition that we needle the extremities, okay? My tradition is one where we're needling as far as possible into that place, right? Away from the disease. And also the symbolism of what fingers mean, right? In Master Tung Acupuncture, which is a seminar unto itself. But just to give you an idea of fingers, well, in fingers, the fingers, well, they represent 5 phases, right? Because each finger is a phase. That's why we have palm acupuncture, which we'll talk about. And then also fingers represent 10, and 10 means completion. So it's almost like you are able to treat, each finger represents Taiji, right? Each finger represents 1, but as a whole unit, it represents 5, so the 5 phases. And then with the 2 hands, you get the 10, which represents that perfection, right? So you're able to treat any disease almost through this Taiji of the fingers. And then just think about the points that are often used most in the Master Tung Acupuncture. It's often in the extremities. Unfortunately, what I see though is a lot of people don't needle the fingers. I see some that do, but some are afraid to needle fingers because it causes pain or something. Yes, it's a bit uncomfortable, but Master Tung is putting them as the 1-1 section. So you have to needle them in order to practice Master Tung Acupuncture. You cannot not needle fingers and say you're practicing Master Tung Acupuncture. It just doesn't make any sense by his categorization. So that's one thing to keep in mind, okay? Each one has a specific structure to it, but see that he first begins in the fingers, then hand, forearms, and upper arms. So he's basically talking about the upper first, which is all yang. So he basically teaches you, okay, I need to teach you what's yang first, right? I need to teach you what's upper first. Then I'm going to teach you what's lower, what's yin. Then I'm going to back to heaven again, the ear and the head. And then I'll teach you something a bit more special, a little bit more dangerous to some degree. And that is the back and front and chest. But then Master Tung will say, well, Master Tung Acupuncture, what's special about it is the back and the front and the chest, they don't needle it. Some actually do. I've seen some techniques where they do needle, but for the most part, it's mostly a bleeding. And the reason is because Master Tung is all about safety to some degree. They don't want to puncture an organ or something. I myself had a pneumothorax one, and acupuncture needle me, and I had a pneumothorax. So I understand Master Tung's his concern for safety, and pneumothorax, I just had a minor one, but I'll tell you, a minor one took me like 2 months to recover from one, and it's this incredible pain. But we have to keep in mind, Master Tung. We're trying basically to dissect his mind, because what's unfortunate is, even if you study with disciples, and as much as they are precious treasures, they cannot pass on to you everything, either because they don't want to, mostly because they don't want to, or because they don't fully 100% know Master Tung's mind. Nobody knows Master Tung's mind. No, even if you study with a teacher for 20 years, you cannot fully know their mind. You could get their essence, but you cannot fully know their mind. So we're trying to dissect his mind so we ourselves get a little closer to Master Tung. So it's not just about trying to learn points. We are trying to understand his Xin, his heart mind, okay? And every little thing he does, we dissect it. Everything he does, we dissect it. So we're gonna just keep breaking down his manuscript. After listing the buwei, the body parts, he then categorizes the body parts numerically through that section. For example, right, so he first mentions 1111. Well, then he mentions in 11.0.1, in 11.0.2, in 11.0.3. And we have to ask ourselves, why did he mention that point as first? Why did he mention, I think 11.01 is one of the Dajian or the Zhongjian or something like that, right? Why did he mention that point as first? Have you ever asked yourself why he mentioned that one first? Well, there's a reason for that. Now, do I 100% know the reason? Of course not. Only Master Tung knows that. But you have to try to dissect why he did that. For example, in the 55 section, which is in the base of the foot, the first point in the section is huobao. Huobao. Huobao means the fire bag, right? The fire bag. And that point is basically used, huobao is basically used, it's usually used to bleed, and is often used for myocardial infarction, right? It's basically used for heart attack. Now, can it cure a heart attack? Probably not. I mean, I haven't used it. I don't treat acute heart attacks like that. But it's nice to know if somebody's having a heart attack, it will probably lessen the effect, the extent of heart damage. And just think of the name, fire bag, huobao. Well, what is a bao in Chinese medicine? What organ is a huobao? The shinbao, the pericardium, the heart bag, right? The heart wrapping, the heart collateral. So, right, this point is basically by the yangming. It's in the point by yangming at the base of the foot, basically at the base of the second toe, and you basically bleed in it. And and you're able to use Yaming to drain the heart, because basically a heart attack is when all the energy of Yaming, which is about an explosion, goes into your heart and boom, hits your chest. And so you're basically trying to drain downward the Yaming from hitting your pericardium, right? But that's why he actually mentioned that point first, because that point is the most important for life-saving conditions, okay? Huobao. Now, another thing to understand is the name of the point is critical to understanding the dynamic of the point. So while there is a textual reasoning why a point can be named 11.0.1, right? Because that is not a Western invention. For some people thought that was a Western invention. No, Master Tung named it 11.01. Or Huobao is, right, called 55.0.1. But ultimately, that's just the way he's structuring the way he's listing points. It actually doesn't give us the meaning of the point. It just gives us, well, the order of it. And while there is an importance to the order, it still doesn't tell us the dynamic of the point. So ultimately, the name of the point is more important to know. However, we have to keep in mind that the order of how Master Dong is categorizing the points within a specific bodily section, as I said. So if you're studying Master Tung Acupuncture, I mean, you need to start to learn the name of the points, right? Do you have to know every name of the point? No, but you want to start knowing some of them. Start with 10 of them, start with 15 of them, because if not, you really miss out on a lot of the meaning in Master Tung Acupuncture. So the second example is the numerical order and the name of the point. Okay, that's how he's basically like giving us the breakdown in his manuscript. The third of how he is introducing his points is the location of the point. Okay, so that is where he's now telling you where the point is located. Pretty simple. But that's important because this is the first time he's revealing to his students where his points are at. So that to us is a very important step to understanding Master Tung Acupuncture. You cannot practice Master Tung Acupuncture if you don't know the location of the point, right? The fourth is the anatomy, right? Jiepo. And this is probably one of the most important things we have to know, because here, why did Master Dong was so focused on anatomy, right? In Chinese, this means to dissect and analyze. So here, Master Dong describes the anatomical features, mostly in the form of nearby blood vessels and nerves. So when he talks about a point, he says, here's the radial nerve, here's the ulnar artery, right? By that point. But then he basically describes something that makes no sense from a Western standpoint. And that is an aspect of five visceral Shenjin, five visceral Shenjin. Shenjin translates to as nerve, but there's something beautiful about Shenjin for those that don't know Chinese. Shen means spirit and Jing means like a channel. So the way that a nerve is being conceptualized in Chinese is the idea of the spirit traveling through the conduit of like a nerve, right? A nerve is basically the Shen transmission, right? Through a nerve signal, right? Just think about your nervous system. Isn't that all Shen, right? So basically, and sometimes he also classifies not just the five Zang as Shenjing, sometimes he classifies the six Fu, but he doesn't really say the stomach Fu. He doesn't say stomach Shenjing. I think there's an instance where he says like the stomach and large intestine Shenjing. I think Menjin, the Golden Gate, right, has that. But for the most part, it's all five viscera. But sometimes when he does say this points affect the bowels, he's going to say six Fu. And then he also says specific, sometimes Shenjing, right? Like anatomical. Oh, this point affects the brain. This brain affects the uterus Shenjing. So, so from this, we get the idea of this concept of zhongjing. Zhongjing means the zheng means the correct, and jing means channel. So the correct channels. And when we say the correct channels, or some people translate it as the orthodox channels, we are talking about the channels in Dong acupuncture, which relate to this concept of Shenjin, right? So we have to try to understand Dong acupuncture through the anatomy of Shenjin and the dynamic of what is described through the concept of Shenjin. So yeah, so I mean, in certain way, this is the essence of Dong acupuncture, because ultimately, what are acupuncturists trying to regulate? The channels. But Master Dong acupuncture is not trying to regulate the ordinary 12 channels. He's trying to regulate the Zhengjing, which is connected to the 5 viscera, right? To the 5 viscera. So he's basically saying, in my style of acupuncture, my acupuncture goes directly into the organs, and he has a certain hierarchy to that, which I'll describe a bit later. So the next way he describes points is the indications, right? All the first points here, right? Dajian, Zhongjian, one of the main things they treat is knee pain, but also things like hernia, right? Testicular pain, stuff like that, right? Mucus that's hard to expectorate, all these kind of things. So those are just basically the indications. And what's interesting is, in the beginning of this 1968 manuscript, Master Dong's indications were quite small, a lot smaller than you see in later books by other disciples, right? So obviously things were added later on as he improved his teaching, or he disseminated more knowledge, or some things were added by disciples, right? That's one of the hard part about Master Dong acupuncture, but sometimes disciples introduce their own weaving into the style, and you don't fully know what is Master Dong or not. Originally, what he said, you have to take the disciples' words. Oh, I learned it from Master Dong. That may be true or not, but Master Dong did not recorded it for everybody. So that's when you have to have more trust in the disciples, that their version is the truth, but then the other disciples have a different version. So that's why it's important to go to Master Dong first and see what he said, and then you get the different narratives that will fill in the pictures. 6 is the shushe, meaning how to locate the point. This is similar to the anatomy, but different than point location. I mean, then the third one, it's different than the point location, because this is more how to tangibly locate it, right? Just think about normal acupuncture. We learn, for example, where UB40 is, Wei Zhong, but in most acupuncture texts, it's not just about needling in the middle of the popliteal fossa. Often you also want to bend the knee in a certain way. You want to find the popliteal fossa in a certain way. And in Master Dong acupuncture, the same way. He locates the points in a specific way sometimes, like a certain chun measurement. Then the 7th way is the hand technique. The hand technique is the needling method, often described in term, right? So this is basically the secret. So it's not just enough to know the points, okay? Not just enough to know the points, location. It's also, you have to know the depth, the angle, the needle technique, such as left to tree right, right to tree left, right? Which is like a fundamental concept in Dong acupuncture, because we're trying to regulate yin and yang. So when we regulate yin and yang, well, we use yin to guide yang and yang to guide yin, right? That is basically elucidated to us in Su Wen chapter 5, right? Then he has another category, which he doesn't mention for every point, but he has a special consideration or a provision category for certain points. For example, certain points you shouldn't needle during pregnancy. Ren Huang, for example, Ren Huang, which is close to basically spleen 6, right? Spleen 6, San Jin Jiao, San Yin Jiao. So he has specific categorization. For example, another point that has specific categorization is the Master Dong's version of GB41, Sulinchi, right? Right, the full container of tears, he has a specific points called shui shu, meaning the water ditch or something, and the water curve or something, water mound, different way to translate that. But that point has specific prohibitions in Master Tung Acupuncture. Like, for example, you shouldn't needle in people that are weak and are asthmatic, people that have certain type of edemas. I forget myself all of them, but he has specific reasons, he has specific prohibitions for that point, and he doesn't even tell you why, right? But some disciples will try to tell you their logic, right? So that's one. And another special consideration is, for example, the points in the 88th section, basically in the thigh, sometimes he'll say, these points are prohibited to needle on both sides, right? You cannot needle them in both sides. So, some disciples will say, well, in systemic disease, you should needle bilaterally, the points. That's true or not, because Master Tung is prohibiting us to needle from both sides. So if you're going to needle both sides, you cannot needle both sides in the same way. You cannot needle 3 points on one side and then 3 points on the other side. For example, Su Tong Xin, the penetrate heart points in the middle of the anterior thigh, which is a very major points for heart conditions, penetrate heart, 88 point, it's in the 88 section. You should not needle both points, Dao Ma, 3 needles on each side. That is prohibited to Master Tung. Yeah. For horses, I think that is okay bilateral, yes. That is okay. However, we have to keep in mind that even for horses, that it's not ideal to needle all 6 points at once either. If you're gonna do for horses, you kind of want to maybe do just 1 point on one side, 1 point on another side, 2 points maybe on each side, and in maybe serious conditions, you want to do it in 3 points in each side. So you remember, Master Tung didn't needle that many points, right? So whenever you see certain teachers, and I saw some certain teachers that, needle 30 points, is that still Master Tung acupuncture? You're needling Master Tung points, but 30 points, Master Tung will never do that. There's no case record of him needling 30 points at once ever. He's actually, that's what makes Master Tung. I needle this point, I can needle this 2 points, and maybe this other point, and the person was cured, So, he's quite simplistic actually, because, and I'll describe a little bit more on that. So one thing that one disciple has done, and one of my favorite disciples, Dr. Wang Chuanmin, right? So I'll repeat, Dr. Wang Chuanmin. He writes basically Master Tung, right? What he did is what he has done the most for us. He has basically categorized Master Tung's textual legacy for us. So we have a lot to thank to Dr. Wang Chuanmin for that, because without him, a lot of people don't emphasize what Master Tung writes, which doesn't make any sense to me, because we are studying his style of lineage, right? So Master Tung, he said, Dr. Wang Chuanmin says, and this is the source, he has a blog in Chinese, and he had 5 Chinese writings. Okay, Master Tung actually had 5 Chinese writings. He had the first one, actually, the third one, I put the third, the 1968 manuscript, which is like a notes, okay? But then he basically had 2 more where he's basically now trying to publish a textbook. So this isn't even necessarily a textbook, it's just a notes. And then he publishes a textbook, which took time because he had to get approved to publish a textbook. And so in the 1972, 1973, right, he basically now has a textbook of Master Tung Acupuncture. And I have the 1973 one with annotations from actually Dr. Wang Chuanmin, which is pretty cool. So that is where he actually adds a lot more material to his 1968. And to some degree, if you want to understand Master Dong's full culmination of what he introduced and imparted, will be the 1973 book. And in certain ways, um, and in certain ways, that 1973 textbook represents the culmination of all his knowledge that he decided to transmit publicly. And some disciples will even say, well, no, actually, that is the culmination of his knowledge. So if you want to practice Master Tung Acupuncture, you want to follow the 1973 textbook and the points introduced there. So any other point that was basically introduced later by disciples, some disciples won't agree with those because it's not published in the 1973 textbook. So we have to keep that in mind. My opinion is I think Master Dong is a living tradition. So I myself don't mind those extra points that are introduced by other disciples, especially if they're first generation disciples. However, what I like to keep in mind is to know what Master Dong introduced himself lastly. And I like to basically keep that in my heart, right? And then obviously Master Dong also had there's other writings, the earliest 5 Chinese writings of Master Dong acupuncturists. These were not written by Master Dong, right? Well, actually, I also have to talk about the stroke cases. The stroke cases where he treated the general president in Cambodia, that's a famous case, right? Where he used things like, where he used basically Zhongjoli, which is Master Dong's version of GB31 functure. It's a bit different though. And Chile, which is 2 below Zhongjoli, right? Those were 2 major points that he used to treat stroke for this general. Also other points such as Lingu Dabai and stuff like that. But why that's important is because we see Master Dong's mindset, and he even introduced a diagnostic in these cases. And the cases basically showcase 5-phase thinking, 5-organ, 5-zone diagnosis. And then these are other disciples. These are some of the earliest writings of Master Dong Acupuncture. Chengdu Ren, basically Master Dong's medical cases. So it's a cool book. This was published even before the 1968 book. And basically, the Chengdu Ren was a direct disciple of Master Dong, and he's a very important disciple because he recorded Master Dong's cases. Without that, we don't see his thinking. The second is Bloodletting Therapeutics by another disciple. Yongwei Jie, obviously, is another disciple, that basically elucidation of Dong extra points. Dr. Hu Bing Chuan, he is not a direct disciple of Master Dong, so he's actually quite controversial. He's a brother of Hu Wenzhe, who is a direct disciple, but he did introduce certain elements of Master Dong acupuncture. And then you have Lai Yishong, who is a very important figure right, one of the most important disciples. Unfortunately, he passed away, but he basically, some people say, one of the greatest disciples of Master Dong. And he actually introduces even post-diagnosis in his book. And he also introduces palm diagnosis. So anybody who says, oh, Master Dong lineage doesn't have post-diagnosis, well, Lai Yin-shong pretty much disproves that, right? He pretty much disproves that. And if we're going to think about palm diagnosis, well, if Master Dong is using palm diagnosis and Lai Yin-shong is introducing it, and he also teaching about post, then obviously post-diagnosis does have credence in Master Dong acupuncture. So it doesn't make any sense to me when people argue that post-diagnosis is not part of Master Dong acupuncture when a direct disciple actually talks about post-diagnosis. Yeah. Another question. Master Dong belongs to a lineage. Are there more similar lines like his? Yes, there are similar lineages like him. in Taiwan, in China? So the simple question will be yes. Uh, who's the M. Martin said he studied with Dr. Huinja. He will use 15 to 25 needles. We have to distinguish what disciples you do and Master Dong do, Martin. I have nothing but respect for Dr. Huinja. He treats very serious conditions. However, I think Huwen just said, when I first started, Lingu Dabai will cure a lot of people. Now, when people have become more complex, I think he says, I use more needles. There is now another distinction we have to keep in mind. Master Dong used specific type of needle, right? Master Dong was not using, he was using larger needles. So in that sense, he used less needles because bigger needles have stronger de qi. And secondarily, I think even Dr. Huan just says stronger, larger needles, less needles, little needles, more needles. But I personally am interested in Master Dong case studies, and I myself can't say I fully follow the tenets of Master Dong's perfectionism. Master Dong is an ideal, but if we never try to pursue that ideal, then how can we ever even understand the dynamic of the point? If you're always needling 20, 15 points, how do you fully know what a point fully does? It's kind of like an herb formula. When a doctor gives 15, 20 herbs, it might work, yes, right? I see acupuncturists who do 60 needles and they get results, right? 70 needles. But in my opinion, they never really know the points. They never fully understand what, I'm not saying Dr. Hu and Jed does not understand. I'm not saying that at all. I'm talking about ourselves. We will never understand what Su Tong Xin by itself will do. We won't understand what Chong Se Chong Xin will do by itself, right? So that's my opinion. Of course, you could disagree vehemently with it. Anyways, these are a picture of Master Dong's writings. Yeah, the ones that we're talking about, the first 5. Another hallmark of the system is its emphasis on the unique points, and in Chinese is called 细学, 细学. This is what people basically translate as magical points. Some authors translate it as magical points. However, this is a mistaken notion that these points work simply because they work without any reasoning whatsoever. And this is but a partial truth, right? This is a partial truth. Yes, we've all had the experience of when we needle Master Dong points, they work. So we think it's magical sometimes. And I think if we just fully just get stuck in that belief, then we get stuck that these points work because they're empirical. There's no logic. There's no diagnostic involved. And we begin to look at the lineage as almost purely magical, right? Which to me is a mistake, because clearly Master Dong diagnosed in his case studies. That's a fact, right? And you just have to look at what Dr. Wang Chunmin has recorded and shared and imparted into stroke cases, what Dr. Chen Du Ren has showed in his case studies, right? It must be noted that Master Dong emphasized the great path arrives at simplicity, Da Dao Zhi Jian, right? The great Dao arrives at simplicity. And this has 3 features, right? Jian Yi Xiao, right? Simplicity, easiness, and effectiveness. So that is what's actually magical about it, that Master Dong Acupuncture has those 3 tenets about it. However, this is not to state that extraordinary points are magical or work simply because of some divine reason. The simplicity is in the tradition of his ancestors who have outlined the tradition, the easiness in the method they passed on, and the effectiveness is in the results. That is the simplicity in the tradition, right? There's the mistaken notion that the Master Dong tradition is divorced from Chinese medicine, as I said, and there's no basis to this belief whatsoever in Master Dong's writings, okay? So here are the unique points. Obviously, I think everybody is familiarized, has some familiarity with some of these charts. So yes, I'm going to another notion is, while Master Dong tradition is different than the 14 channel Jingbo, this is not to state that Master Dong did not have expertise in traditional acupuncture and that is not part of his thinking, right? It is distinct, right? But he integrates Jingbo. Integrates it. How do we know? In 1973 textbook of Master Dong, we clearly see a section in the appendix where Master Dong uses 14 channel points. And not only that, he uses the 14 channel points. For example, lung 10 treats whole body pain, right? Whole body bone pain, lung 10. That's why even Wu Hu can do that, right? Even Lie Chue can do that, lung 7. Now, why would that treat all whole body pain? Well, you have to see how Master Dong is thinking about the point. But clearly he's using 14 channel points. He's just kind of using it in this specific way. And actually, if you begin to actually dissect a lot of those points, you see a lot of those indication comes from earlier indications. For example, remember, 肺主直接肺主 the lung governs 直接 the rhythm and regulation, or management and regulation. The lung governs the whole body's rhythm, right? Which means the lung governs qi, right? Lung governs qi. So when this lung dynamic, remember the lung in classical Chinese medicine is responsible for the movement of qi throughout the whole body. It's the catalyst of qi. So when the lung fails to do that, then you start to get basically stasis in the body. Hence, why lung 10 or any lung point can treat actually whole body pain. Lung 10 is by a fire point, which fire point treats pain, right? So they help disseminate lung qi to the exterior, and any exterior condition can deal with pain, right? So when you get pain, that could be actually related to the lung, right? So yes. Additionally, Master Dong style pricking Lomai, right? Master Dong bleeding style, he pricked Lomai, right? He also pricks other things, but a lot of it is pricking Lomai, these collateral vessels, right? These network vessels. And Master Dong family lineage bloodletting is different than folk style bloodletting. It is precise, it is regional, and based on principles. Principles similar to Ling Shu needling called Luozi, network needling, outlined in Ling Chu chapter 8, right? So already we see that even Master Dong style needling, certain kind of points that Master Dong needled, we can see that there is classical basis to it. Another thing to keep in mind in the style is Master Dong in his preface mentions this 5 zang depiction or diagram, likely coming from a Qing dynasty text called Shun Jing Kao Xue by this doctor named Yang Zhen, right? This emphasis on these depictions demonstrate why Master Dong put his 5 visceral Shenjin concept in the anatomy section, right? So he's obviously being influenced by the tradition of text, and this is where we get the 5 zang diagrams. There's different diagrams in this book. The Shunjing Kao Xue. Shunjing means to basically follow the channels, abide by the channels, and research the points. And this Qing dynasty text, Qing dynasty obviously is from 1610 to 1910, somewhere around there. Or no, 1644 to 1910, something like Qing dynasty, Qing last dynasty of China. And this book has all these depictions of the organs. And Master Dong mentions basically this book, right? This is just one example of that, okay? Now, the concept of Dong's orthodox channels or regular channels is based on his own family's perspective on channels, right? So if you're studying Dong acupuncture, you're in for a treat. You're basically going to start to study different channels, right? Different channels, but channels based on five zang, right? You're not going to study like channels like you study normal acupuncture. You don't have to study like the gallbladder channel starts here, then GB2 goes here, then goes to the loop. You don't do that in Master Dong acupuncture. His study in acupuncture already, right? His Zhengjing, his correct channels, right, already tell you they go into the organs because they're based on Wuxing principle, five phase principles. But you still have to try to grasp the notion of his Zhengjing, which is different than the orthodox, or not the I mean, I say orthodox here, than the normal acupuncture channels, the 14 channels. As I said, his channel is directly connected to Wuzang, which of course includes Wuxing. If you include Wuzang, you include Wuxing, right? Five phases, five elements, and also the Wu Yun, the five movements of the five planets. How do we know that's true? Because Master Dong mentions a bunch of points in regards to astrology or astronomy. Mudo, mulio, mulio, right? 66, whatever, or 77, whatever, no, 66 something. Mudo, wood scoop, right? A bunch of points in the back have this idea of astronomy, like the Xixing, the seven stars, the phoenix points, right? All those are based on basically Wu Yun Liu Qi, Wu Yun Liu Qi. Hence, why we can say Master Dong begins in the fingers, as there's five fingers, as there's five zang. We also know Master Dong heavily diagnosed through palm diagnosis, which is based on five phases, right? Remember, we say that, what did they say? They say basically heaven is I think they say heaven is round and earth is square. I believe they say that, right? And the palms are supposed to be square and your head is heaven, right? Your head is round. So it's heaven, the palms represent square. So basically, all five phases are represented in the palms, right? Hence, for example, even in normal herbal diagnosis, when you get like Yaming disease, where do you get five palm heat? Where do you get this heat? In the palms. In Yaming disease, the hands get hot because the stomach gets hot, right? So basically, five represents the idea of being able to, it's like five represents in Chinese medicine, it's like the center point of a compass. So it's like you put your pole at the center of the earth, and then that creates a shadow in the four directions. And that's what we're actually trying to do when we diagnose a palm. The palm represents setting our pole, our vision, and then we see what compass, what direction has those shadows, has those disease, right? I don't know if I'm explaining that correct, but a heavy internal condition focus then for Master Dong. I don't understand the question. What about the depth and angle of a needle point and intention? What about bleeding? How much in deficient condition the area points are associated with which? Oh, that's too that's too in depth. That's a whole discussion. Depth and angle, you have to study it. Intention, intention. Master Dong doesn't necessarily talk about intention per se, but that is just intention. You have to think about what that means in acupuncture in general, right? So that's a different discussion. Maybe I'll answer it at the end of the day. What about bleeding? How much? Depends on what you're treating. In deficiency conditions, you go actually bleed a deficient person. It just depends how you bleed them. The area associated with a particular organ, that's a study unto itself, right? So I like your questions, but they're a little too broad, actually. So Zheng as a concept needs to be understood, right? When someone uses the term Zheng, it is the same as rectification, a correction. In other words, the ancestral family, the Zhu of it, sought to rectify their knowledge of acupuncture and how to fu Zheng, support the righteous. Because just think about what Zheng means in Chinese medicine, right? Zheng pertains to the Zheng qi, the correct qi, right? Zheng represents the idea of the Confucian idea of behaving in a proper way, right? So it's almost like that Zheng represents the idea that Master Dong is correlating with the whole philosophy of Chinese culture. So it's not just, so when we think about Zhengjing, this Orthodox channel, when we see the word Zheng, to someone who's Chinese, I'm not even Chinese, but as soon as I see Zheng, all those concepts of Zheng come into my mind. And you have to see that he chose that for a reason, right? This Zheng then becomes a way to codify their system. And Master Dong introduces it as a separate from Jingluo, right? The channels and collaterals. This is because Jingluo is based on Shidongbing and Suoshengbing, as per Ling Shu, right? Shidongbing means when the disease stirs, and Suoshengbing is, or when the vessel stirs, the stirring of disease, and Suoshengbing means that which is disease generates. This is we see that in Ling Shu chapter 10, right? So the normal channels are linked to this concept of Shidongbing and Suoshengbing, right? You have to read Ling Shu chapter 10 to understand that. And the symptoms of channels are basically related to this. But Master Dong actually bypasses that, right? So when we say they're different than the 14 channels, what does that mean? Well, Master Dong acupuncture bypasses Shidongbing and Suoshengbing related to the 14th channel, and he codifies it in a different way, right? So he basically, right, this Shidongbing and Suoshengbing are concepts related to illness in the viscera, but it's reflected in the 12 or 14 channels, whereas Zhengjing are used to directly assess the matrix of visceral transmission. Okay, I'm going to repeat that. Whereas Zhengjing are used to directly assess the matrix of visceral transmission as related to the concept of Chuan, which means transmission. And this is related to the 5 Wu Sheng Sheng Ke, the engendering control cycle, which include the concept of Shun, Ni, Ke, and I think Wo, following, counterflowing, controlling, and insulting. So whenever we talk about 5 phases, we are basically talking about the dynamic of this disease. So what that means is, and I think even Dr. Wang Chunmin talks about in palm diagnosis, if you have a heart disease, but you have a water sign, right? I mean, this is not Wang Chunmin per se, this is just classical concept, right? Then that's a very bad sign because water overpowers fire. Same thing if you have a spleen disease, as Jingwei chapter 1 tells us, if you have a liver disease, know that it's going to transmit into the spleen, right? So when we talk about Wuxing or Faizan, we have to think about the diagnostic of what this means. This concept of movement, right? And sometimes, so what that means is if you have, let's say you have heart fire. Okay, let's say you have heart fire as a diagnosis. You could say, yeah, I'm just going to need a heart fire points. I'm just going to need a heart aid. In Master Dong Acupuncture, Wushin Shanka, you say, this person has heart fire, right? Heart yang exceeding outward. I'm not going to actually needle the heart, right? The heart is not the issue. The heart is the water is not controlling the heart. So I'm going to needle Su Tong Shen, right? I'm going to needle penetrate kidney, right? Penetrate stomach, right? Those points that treat the kidney, Dong Acupuncture 88 section. Because why? Those points nourish kidney yin. And when you nourish kidney yin or kidney water, it will extinguish heart fire, right? But you only arrive at that kind of insight through Wu Xin Shenke, right? Yeah. Um, it's quite different than classical sinew treatments. It kind of doesn't have to do anything with classical sinew treatments. I know what you're talking about, Kara. Um, but there's debate what classical sinew treatments mean as well. We have to keep that in mind. People treat sinews through different means. So yeah. Anyways, because classically needling the sinews, you use fire needle, right? According to Ling Shu chapter 13. Master Tung acupuncture has nothing to do with sinew channels per se. Okay, so yeah. Now, anyways, dynastic schemata. Now, just because Dong acupuncture follows a different method of influencing the body, actually, let me say one more thing about that. You asked about Wei Qi. Master Dong is not just about Wei Qi. Master Dong, we treat Wei Qi, yes, but remember, this is Zhengjing, right? And it's directed to Wuzan. So if it's connected to the 5 organs, then we say that Master Dong is directly working on Yuan Qi, on source Qi, okay? Doesn't mean he does not treat Wei Qi, but it's almost like he'll treat an organ that treats so he'll treat Sima, 4 horses, the Yuan Qi of that point, and then by treating the Yuan Qi of the lungs, well, the lungs already affect Wei Qi. So it's kind of that kind of thinking. But it's very different than trying to directly affect Wei Qi through channel needling, through sinew needling, or in Japanese acupuncture, for example, they have specific needle techniques where they affect the Wei Qi. Actually, you could say that a lot of Japanese acupuncture works through Wei Qi, right? Because it's sometimes they don't even needle the point. They just kind of blow. No, they don't, but they kind of just tap on the point, or sometimes they do very superficially, but that is Wei Qi needling. Now, when you needle Wei Qi, you can certainly affect the Yuan Qi, but it's almost not directly Yuan Qi needling, right? Anyways, now just because Dong acupuncture follows a different method of influencing the body, it still relies on understanding diagnosis, including the facets of pattern, disease cause, disease mechanism, etc. Right? So it's no different than any other acupuncture style where you're trying to basically understand what's happening in front of you. The points are burned, right? That's why Master Dong was able to supposedly just treat disease with a few points, because he had such clear insight where the disease was coming from. Okay. If you don't have insight, then you need more points to try to strike the disease. But if you know where it's coming from, you hit it. And even Master Dong basically said, there's a case of, I'm trying to remember, I don't know, I think it's some type of leg pain or some type of issue with the leg, numbness or something like that. I don't remember exactly, some type of issue with the leg. And Master Dong basically needles Shan Cang Huang and needles Su Tong Xin, like those points in the 88 section. And he needles it like twice and it doesn't work. And Master Dong said, oh, this is not a Qi issue. This is the blood issue. So now he actually bleeds and the person gets better. You see, that's actually diagnostic differentiation, because Su Tong Xin and Shan Cang Huang actually affect the blood, but they affect the blood, like heart and liver. They affect the blood still through Qi, because acupuncture still works through Qi. Then Master Dong says, well, I'm trying to influence the blood, but it's not working, so I need to directly bleed, right? That's a diagnostic differentiation, Qi versus blood disease, right? The points are but an extension of understanding what one is treating, not just the Western disease name, but the dynamic behind it. Hence why Master Dong did palm diagnosis, but also occasionally used pulse and complexion diagnosis. Hence, actually, some points were not passed on by Master Dong. Some points Master Dong discovered. And one point of that is muho. Muho means the wood fire, which is basically on the middle finger here, and he used it for stroke. And and he basically, I think the story is he saw some vessel in this person with stroke. Well, think about the significance of that. first of all, if you saw some type of vessel, dark vessel or green vessel in these points that may not even have been a point at that time in this tradition, well, think about it. This person had a stroke, and what do we often categorize stroke as? Well, a wood fire condition, right? Right, basically liver yang rising that leads to heart fire that causes some type of cerebral bleeding, right? Or some type of liver fire. You know, it's this wood fire condition, liver wind, steering fire, whatever, steering phlegm. But and the point manifested where in the middle, right? Muhu already tells you the dynamic, wood fire. But think about where it manifested in the pericardium, right? Wood fire basically affecting the pericardium, the consciousness. So hence he named it Muhu. This also does not mean that if one uses tongue or abdomen or any other diagnosis, one cannot practice tongue acupuncture. Remember, one is trying to grasp the essence of the person through the four diagnostic methods. Just because Master Tung did palm diagnosis mostly, right, does not mean that you cannot use any other method, right? It doesn't really matter, actually. As long as those methods actually get you to Wuzang diagnosis, right? I personally prefer palm. I use some palm, but I mostly emphasize pulse myself, but that's just me. Pulse and complexion. I'm sure Master Dong also did facial complexion, you know. Palm diagnosis, because palm diagnosis, let me see. So I'm just going to introduce this palm diagnosis for you guys. Palm diagnosis was revealed by one of Master Dong's disciples, Lai Yinsheng, in his Dong Shi Zhenzhou Xi Xue Jing Yang Lu, I think it's called. Here he gives very important features of palm diagnosis, right? First characteristic Master Dong will look is at the color, right? In particular, examine if there was superficial vein or spots. So that already tells us this bandian means this macular spots, these little spots. That's the first thing Master Dong is looking for, these vessels. Hence why I say it's related to Ling Shu, because Ling Shu is always looking for those vessels, right? Always. So the first thing he does is, where are the vessels? Where's the spots? Like Muhu, where's the, oh, there's a spot here, right? And now this person has a wood stroke. So he looks at that, and either palm diagnosis or even looking at the points themselves, deciding exactly where to needle. So in other words, point location is fluid depending on where the issue is at, right? So meaning, yes, we find a point specifically somewhere, but if you see a certain kind of finding, you need to change your point location in regards to those findings. Then he will also look at the color and luster of the palm to diagnose the disease condition. White is chronic pain. Green is internal. Zhang have the functional imbalance. Right? Green also means it governs cold, acuity patterns, as well as bad circulation. White means chronic pain because there's some type of qi deficiency, right? White is the color of metal. So, right, so that's why, for example, lung tend to treat body pain. So white means there's deficiency. That's why it's chronic pain. Green means, well, this is a wood condition. So it's going to basically, wood means wood governs blood, liver governs blood. So that means it's going to either lead to some type of stasis pattern, bad circulation, and also green kind of symbolizes circulation is being impaired, hence why it could be cold, right? Or even vacuity patterns. Yellow means chronic disease or jaundice. Yellow means it's affected your body's constitution almost, right? It's affected your spleen. Red means acute inflammation. I don't know, acute inflammation or heat evil. That's pretty easy. Black means long-lasting illness, extreme stasis, or dangerous patterns of untreatable symptoms. Obviously, that's related to water, so it's almost affected your jing. So it's green affected your blood, white's affected your qi, yellow's affected kind of your fluid, your yin qi, your nutritive. Red's affecting also kind of the blood, but the spirit. The black's affecting your essence, okay? Notice this on the color of the 5 phases. So depending where the color manifests, it can showcase 5-phase disease relationship. For example, white on the fire zone is more mild than black on the fire zone of the palm because of the relationship between, right? White on the fire means metal on fire, which is actually not a severe pattern. But black on fire, that's a severe pattern. So someone comes to you with a cardiovascular disorder and you see white, well, don't be too alarmed. Second aspect is the morphology of the features. What's your question? The second aspect is the morphology of the features. That tells us what the actual, how the palm actually now is looking. Because first he's basically looking at the veins, right? And then the overall color of the palm. In this now he's actually looking at the morphology, the actual, how the actual flesh and everything looks, right? So the first thing is, if the findings are superficial, the disease is initially beginning light or it's a new disease. So if you just begin to have some kind of spot or discoloration, if it's very light, then it's just beginning. If it's almost like very deep or scattered, then it's more severe, right? So it's almost like, this is a classical concept in the Ling Shu they described this idea of fu chen. Fu means superficial and chen means deep. Kind of like in palm diagnosis. There's floating poles, fu, and there's chen, there's deep poles. So same thing with palm diagnosis. There's superficial findings and then there's deep, okay, findings. And it's almost like how ingrained it is, right? How ingrained it is. The second aspect of palm of this morphology is disease location based on color. If the color is shallow in the skin, it governs exterior conditions, right? So let's say you have redness on the skin, on the lung aspect, right? Right, in the lung aspect, and it's superficial, and the person's coughing, wind heat. But now, so let's say the redness is more scattered throughout, more deep, and the person's coughing blood, right? Not wind heat, right? Fire toxin, okay? So it depends on how deep that redness or that color is at. If the color is green-blue, it is in middle, in between. We can say fu or xiaoyang, achieve stagnation. If the color is black, the disease is interior. We can say zang or blood stasis, right? Yeah. So black is probably the worst color, okay? The third feature is the seriousness of the disease based on distribution of the spots. If they are sparse, then disease is comparatively light. If they are dense, the disease is comparatively serious. Fourth feature is the disease state. This is now talking about the flesh, right? If the flesh is prominent, this is a repletion pattern. The disease is comparatively severe. I see this with a lot of people. It's like their fingers are fat, their palms are fat, right? And we know the diseases, they have a lot of repletion, they have a lot of excess, exuberance, right? We need to drain them. If the flesh is sunken, that's vacuity pattern. They have a zang fu. The organs are, the disease is deeper, the zang. If the palm color is light or pale, this is zhengqi vacuity. If the color is strong, concentrated, there's evil qi exuberance. So already you're seeing the bagang here. You're seeing the 8 principles. You're seeing repletion, vacuity, interior, exterior, right? Yin and yang, right? Exit, all those kind of things. And of course, the last thing on palm diagnosis of Master Tung is each finger belongs to a specific organ and corresponding system. There are different variations to this though, but this is the standard basic one. The thumb relates to the mind and the brain and the central nervous system. Some say also the spleen and stomach. That's based on Ling Shu chapter 10, right? So brain and mind. Index would pertain to the lungs, intestines, stomach, and breathing, gastrointestinal tract. So most points that a needle there affect that, right? Middle finger represents the heart and circulatory system. Ring finger affects the liver, gallbladder, and little finger affects the kidney, bladder, reproductive, and urinary system, right? So, yeah, I mean, I think that's quite known actually. There are certain things, I don't think this is actually specifically from Master Tung himself or Lion Shong, but it is something that some have introduced in the palm diagnosis in Master Tung acupuncture. Some put the different lines, different lines relating to specific physiological systems. I don't really use it myself, but some are interested in it. The lifeline relates to the gastrointestinal tract. The intersection between the frontal end of the knowledge line and lifeline is the respiratory tract. The emotional line is the circulatory line. The matrimony line is the reproductive and urinary system line. The knuckle crease at the proximal end of the thumb is the discharge elimination line. So this kind of crease here, that has to do with how well you're eliminating, right? Yeah. But I don't even remember all the lines. I forget which is the lifeline. Now, the last thing I want to speak about is the different needling methods in Master Tung acupuncture. I'm not going to basically talk about all of them, but I'm just going to try to introduce what are the actual needling methods in its original text. So somebody mentioned about needling. These are the ones that Master Tung emphasizes. Perpendicular needling, okay? Most points are perpendicular. A lot of points are perpendicular, okay? So it's perpendicular. Then oblique needling, okay? That's another one. Then you have shallow needling. Then you have deep needling. Then you have cutaneous needling. So it's a different than shallow needling, cutaneous, because you're kind of going under the skin, kind of like a threading. Then you have upward twirling. This is similar to Nianjuan Fa, to when you twirl the needle. So it's not true that Master Tung did not manipulate the needle. But he's not doing any crazy techniques. He's just either tonifying or supplement, downward twirling, stationary needling, where he just needles and doesn't do anything, which most people do, right? But he also does upward twirling and downward twirling. Now, Master Tung did not emphasize techniques for supplementing and draining, or techniques for plucking, shaking, twisting, moving to and fro. This is not because those techniques do not work. Okay, so it's not Master Tung. Master Tung is not criticizing those techniques, but he found them complicated and possibly painful. And so he just didn't necessarily feel they were necessary for his style of practice. But he had certain friends that did those techniques and are famous for them. So yeah, so furthermore, there are other techniques mentioned, some by Master Tung in other places of his texts, or case studies and others by his disciples. So first is the moving qi needling method, dong qi. That's when you needle a point, let's say lingu dabai, and then you have to move your back or something, right? That's moving qi. Then, of course, this needling method, first for sure he introduces in his book, is the left-right transmission method, which is you have right side pain, needle left side, right side pain, left side is pain, needle right side. So it's needling opposite side. Up-down transmission method. If you have head pain, needle below. If you have foot pain, needle above, right? For example, we see that, for tumors, you're often needling the foot, right? Dauma, which is the most famous needling method, but I think it's a misunderstood needling method because people believe that Master Tung is always 3 needles, and that's not true. Dauma is shen. Dauma is a line. Dauma is a line, and you have to figure out where to needle in that line, right? Based on what you're seeing, what you're feeling, right? So you don't always have to needle all the points, right? In the Dhamma. And as Master Dong practiced more, sometimes there's said that he will sometimes even use huema. Huema means union needling. Huema basically means that he's using one needle to unify. He's using, for example, lingu to daba to lingu. It's still lingu daba, but he's using one needle to connect them both, right? 72 extinguishing points. That's actually from Dr. Huenzhi. That's not from Master Dong. It's this idea of you have this disease, this point will extinguish that disease, right? But Master Huenzhi, Dr. Huenzhi, he says that Master Dong introduced him to him, those points to him. But there's debate on that. 32 resolving points, and another Master Huenzhi idea, those are to treat toxin, right? Toxin. Then there's other techniques from other lineage. For example, Dr. Wang Chuanmin, and even Dr. Lai Yin-sheng. They often talk about 5-phase needling method. So for example, you needle at a specific depth, the point. So each point can have a different function depending on the depth you needle it, because that will interface with a different organ. Master Dong actually gives us evidence of this. For example, Shan San Huang has 3 depths, he says. The first depth is the kidney, the second depth is the liver, the third depth is the heart. So if you have a liver kidney condition, you want to needle Shan San Huang, the 3 yellows, superficially. If you have a liver condition, right, liver disease coming from the kidney, coming from the liver, you needle the mid depth. You have a liver heart condition, you needle Shan San Huang deep, right? Then there's the unfixed point needling method. This is not ashe, but it's basically telling you that in certain kind of circumstances, don't get fixated on points. You want to get fixated on regions. And within those regions, you want to explore where the disease is at. And that's how he, for example, found Muhuo. So it's almost like a variation to points. And lastly, one needle miracle. So a lot of times they'll say for very stubborn conditions, he'll use this unfixed point needling method, because that's the only way he will discover where to needle exactly to cure this disease that nobody else was able to cure, because people were too focused on points. And then lastly, one of the other technique I know is the one needle miraculous effect method, also known as the grain rice needling. Example of Muhuo. Hu and just statement that is where acupuncture reaches the realm of art. I don't really know too much about the needling method. So I can't say too much about it, but yeah, that's when you find that magical point that basically just resolves this really severe disease. And that's actually what Master Dong was trying to do. Okay. Let's say answer questions. How do you explain the skin indication for 4 horses? It's about qi stagnation related to qi deficiency in liver and lung, and that's why you needle point between stomach and gallbladder to move the qi that's stagnated. Well, to give a little bit of excerpt on Sima, first of all, you have to separate this idea of gallbladder and stomach. That's one idea. And then you want to find the idea of, because you're conflating the two, you're putting liver and lung, and then you're thinking about channels. First of all, don't think about channels first. Think about the Shenjin. So liver and lung condition. So already telling you is related to lung. So to some degree, it answers the question already. If it's related to lung, it's going to treat the skin. But what's the liver component? That means the Sima is treating a condition, and you have to pay attention to the hierarchy of that nerve, of that Shenjin. If you look at the liver and lung, they don't have the same hierarchy. The lung is the main hierarchy, the general Shenjin, and the liver is like the liver branch or something. So it means that that's the pathomechanism, that's the disease mechanism. The primary mechanism is in the lung, and the secondary mechanism is in the liver. So if Sima will work very miraculously for a condition where there's a primary mechanism and a secondary mechanism in the lung and liver. So is it related to qi stagnation? It's related to this idea of what lung symbolizes and what liver symbolizes, which is related to what? To wind. Okay, it's related to wind, right? It's related to wind, and that wind can get stagnant and affect the qi mechanism of the whole body. It's particularly in the lung. So it's like the wind relates to almost this immune compromise, right? The wind, this feng, this wind condition, this right wind moves throughout the whole body, and the lung is the susceptible canopy. So when wind strikes the lung, it weakens the lung. The lung cannot govern qi. When the lung cannot govern qi, then it leads to blood stasis. Blood stasis leads to heat, and you get this autoimmune skin condition. Okay, so something like that. But I don't know. It's a complicated question. Is the course accessible to absolute beginners of the style? I mean, we go from straight beginning. We introduce all the points. Now, I will say that I introduce a lot of information. So you want to really delve deep into it, because I do go kind of deep on it. Okay, so do you teach the bleeding techniques as well? I don't teach the bleeding techniques. I mean, I can't really teach that online, but I bleed a lot. So I don't really teach it too much. I mean, I've taught it. I've taught a seminar aspect of it, but it's not my focus on this course. Yeah. Any other questions, or if not, then thank you. Been a pleasure.
Thank you very much. Even make sure to follow Even Cloud on social networking. Also check out Global Branches activity. We have a YouTube channel with lots of free webinars too. And don't forget, the course will start in approximately 1 month, and there's an early bird coupon until April 13. Even where can people follow your work? I don't know if you use a lot of social networking or not. Tell us
I
about
just I just teach. I just pretty much share Ivan Cloud and share my courses there. Pretty much Ivan Cloud on Facebook. You can follow me there.
Okay, perfect. Anyways, thank you so much for this amazing content. Time totally flew by. We're past 1 hour and a half of webinar, so thank you so much for your dedication. Thank you to our viewers for following us and trusting us with these webinars, and we hope to see you all very soon.
Thank
Bye and
you.
take care. Thank
Bye
you.
bye.